Hello, everybody.
Hello, everyone.
Hi.
This is Crystal.
This is me.
Dr. K, and I'm Lisette. Today's main topic is, as you can see, breast implants and the different types of breast implants, but we're open for all questions. Please go ahead and send us your questions and we will gladly answer.
We already had a question, yeah?
Yeah, we also will be taking a little bit of time just going over all the previous questions that patients have submitted through DM or through the live story that we post there. So yeah, we'll be taking some time to answer all of your questions.
Very good. And I got my peel, by the way, last week. Do I shine more? Classic, yeah. I got an instant peel. Yeah, that was a quick peel. That was a lunchtime peel.
How did you like it?
I like it very much.
Yeah.
I like it. I could feel the difference, yeah.
Yeah. Good.
Yeah, our great esthetician, Leslie, she did it for me a few days ago. And I didn't notice any redness or,
No.
did you notice any inflammation?
No.
Everyone's different, but no.
Yeah. Of course, the time of the peeling, I could feel a little bit burning sensation. It was
Well,
natural.
tingling.
You have to feel that. Yeah. Otherwise, it's not going to do anything. Yeah, that's good.
That's
Yeah, as the way that Crystal list, they said it. We want to go a little bit more into the detail of the implants, talking about the different type of the implants, more information about those. So, okay, where you want to start with? I'm ready.
Yes, so you can discuss about the ideal implants because those are implants that we hardly talk about, but
Yes.
we do offer it here. And we've
So-
actually had a few patients have this procedure
Right.
Yeah.
with the ideal implants. And as far as pricing, it reaches the rate of the silicone implants, more or less.
Yeah. Let me start with that the ideal implant, the word of the ideal is a brand name. So I want to make sure that the same token that I have a lot of respect for those brands and they making new products are coming, but the name of the ideal is just a brand name. It doesn't mean definitely by itself, by its nature, is the ideal implant and give a kind of a superiority of that implant to the other type of the implant, but that's just a name, a brand name, like the name of the other implant. Those are the brand names. But the things is gonna make this implant. I start with that. I think because also one of our patients asked us to talk about more about that.
The
And that's
ideal.
why yes.
Right.
And I would like to start with this. Even it's not, at least in my practice, is not the most common, but the number is going up. First of all, is a new type of the implant, and the people they need to have more awareness about that. But it's a good product. Let's start with this that I'm showing you. Technically, is a saline implant. So before we talk about that, maybe I need to just take my time a little bit to say what's the difference between saline implant and silicone filled implant.
Correct. Yeah.
Yes.
I have some here.
Oh, good.
I have a saline implant here, but it's not actually, I know. These are the implants that we do have in our consult room, and patients are able to stop by and just like play with them,
yeah.
and try them on. But this is the saline implant. As you can see, it's been filled a little bit with
Saline,
saline,
which is the IV fluid.
Right. It's only
Yeah.
a little bit filled, but that's not how it actually is filled once Dr. K puts it
Yeah.
inside the patient. Correct?
Yes, absolutely. Otherwise, when you walk
It's a
around,
balloon, yeah.
it's gonna make a noise. We don't want to do that. Yeah, but the good thing is the way that Crystal started to show that to you. We need to know that each implant has a shell or the wall of the implant and whatever is inside. The saline implants, they come as the empty bag. So again, that is just for demonstration. And the bag has a valve. It's so difficult, maybe you catch it on this view, but the valve, the surgeon is going to use it with a connecting tube, take the all air out and replace it with saline. And saline is just the IV fluid. It's a medical IV fluid. It's somebody they call it salt water, but it's very to simplify that. The silicone implant, they like this, they have their own shell. We don't see it because all the air is out already in the factory, they're already pre-filled in the factory, and the content of this implant is different from this implant, and the content is silicone gel. So that's the basic differentiation between the saline filled implant and silicone filled. But going back to the subject of the ideal implant, considering the ideal implant is a saline implant, let me unwrap it, this gift. Here we go. Oh yeah. It's a saline implant, but with a special type of the design that has two valves in the back and in the front. So it makes the different chambers inside that. The design is more complicated compared to just the saline implant. And the beauty of this, the designer, the people, the doctor, actually I know him, that he invented that, is gonna give a more natural feel. Feel is gonna get more natural, closer to the silicone filled implant. At the same token, it's gonna keep the advantage of the saline implant in terms of it comes to the leakage. So it's so easy to detect that. The person is standing in front of the mirror, you see one side is getting smaller, okay, the leakage is there. If there's no difference in the size, there's no leakage. So that's the good thing about the ideal implant. So has the advantage of the saline implant, at the same token is the feel is getting closer to silicone.
I have a question.
Yes.
Since it has two valves, do you think it has a higher chance of rupture?
Very good question. Because most of the
one.
leakage happens right at the junction of the valve to the shell. To the best of my knowledge, there is no that much difference in terms of the leakage. But keep in mind, it's a fairly new product in the market. It's FDA approved. It's safe to use it, and so far the numbers coming out, they're very competitive with the other type of the implants in terms of the leakage. However, if you ask me, is it 20 years in the market like the other implants? No, they are not. So it's not like a 30 years old implants in the market. No, they are not. So maybe in the future, more information is coming out is going to be different, but so far, yeah. But that was a very good question. We are about maybe two times.
Also, because it's a new implant, we haven't came up or faced a rupture yet.
No, not
as
yet.
far as the of any of our patients, as far as the warranty program,
Is the same as
is
other.
the same.
Yeah, it's
Okay.
exactly the same as the other factories. They provide one implant for free if you go with saline. If it goes with the silicone implant, they provide two implants for free
Good.
for you.
That's
That's a
good.
lifetime. That's a lifetime
I'm
one.
just like playing with the
Yes.
here. They're
I-
fun.
I have another implant for you if you want to
No.
play. Yeah.
Well, I think
It's gonna give more natural.
I know.
Yeah.
I'm just playing with all these here. So you did mention that with the saline you fill it up, and with the silicone, it's already pre-filled.
Yes.
Correct. So
Right.
when patients, same with this one, they don't come already filled like this.
Absolutely.
On the day of surgery.
Yes, we'll take the air out as different chambers, that it has two chambers.
Right.
And then one of them actually we have to go with a fixed number,
Mm-hmm.
and the other chamber we can play with the volume and put a different amount of the saline.
That's good. That's
Yeah.
cool. Someone did ask about the this patient. She said she had the implant 2 years ago. Does she need to do a mammogram every year?
If I guess because I wish you can tell us what kind of the implant you had. If you can tell us, I can give you more information. If you had the silicone filled implant or you had the saline filled implant. You asked me about the mammogram. Am I correct?
Right.
Yeah, okay, not MRI.
No.
Okay.
She said mammogram.
Mammogram, we start at age of 40, and that's a screening test, and you keep on going that once a year.
She said she has silicone.
Oh, silicone. Okay, silicone is different. Silicone. When it comes to the mammogram, is again the same as saline implant. Keep in mind, mammogram is just for detecting or screening for any cancer. All right. So it doesn't matter if you have the saline field, silicone field, ideal implant. Still, starting at age of 40, you're gonna get the mammogram. Keep on going once a year. However, when it comes to the silicone filled implant, there is another another factor you need to consider that according to the FDA, is not mandatory, is recommended. Again, it's not mandatory, but it's recommended to get an MRI 3 years after your silicone implant surgery, and repeat that every 2 years to catch the leakage of the silicone implant. Not for the not for screening for the breast cancer. That is for the screening or to catch any leakage of the silicone material.
Is there like some kind of sign she can
The most, yeah, good question. It's been studied that the most common complaint of ladies with the leaked silicone implant is just they go to the doctor and say, hey doctor, this is not the same feeling as before. This is not the same breast as before. That's quote unquote the most common complaint.
They would know themselves.
Yes, and exactly. And after that, then the doctor should examine. Of course, we had a case actually. The lady had the silicone filled implant done in overseas, and the product was, after we took the implant out, we noticed that's PIP. PIP was the implant made in France and was in Europe, and they noticed they used a not proper silicone material. Anyway, after I took her implant out and I noticed that that's PIP, she didn't have any information. However, that patient, I remember when came to us, she was complaining of a lymph node in her armpit, and she had a painful lymph node because of that leakage of the old implant in the past from a product that was not offering in the US. And then I took that the material and all the lymph nodes. But again, you asked me about the complaints. Those are the other cases we had. The lady came and with a mass, a lymph node in her armpit that was painful.
It was like a small potato.
Yes, and I have to say my patient was a little bit nervous, was thinking it could be cancer or not. We had to hold her hands and we walked her through, and then even when it came to the pathology report, the two pathologists, they had to evaluate that. I remember we sent her for a mammogram or an MRI study.
MRI.
Yes,
MRI.
even for the good radiologist in town, she had not seen that kind of the cases. She back and forth. We had a lot of consultation to go through this case.
Yes, if you have implants, try to retrieve records and make sure if it's a PIP.
That was PIP.
Yeah, if it is, you do need to remove them and replace them.
Yes.
For sure.
Yes. Fortunately, we never had PIP, or we didn't have in the market here, and that was most of the cases done overseas and in Europe. But yes, those are the implants better to come out.
Okay.
Yeah.
I think so. Now that we know the differences of the implants, we can
A little bit.
bit.
Okay. You're getting more to the details of the.
You can kind of have an idea.
Yeah.
So how do you place them? A lot of patients, when they do call, and I'm sure Liz can agree, they ask whether it's done under the arm, through the belly button, under the breast fold, on the area of areola. Like how do you
Very good. Actually, you said all of those.
I did.
She's acting like a surgeon. And that's good. One day I cannot practice. I can take over. Yes. Whatever Crystal said is true. I mean, the four ways to put the implants, they call the approach. How we approach, or where we're gonna put the incision and make a cut on the skin to put the implant. For the silicone implant, the approaches, the most common approaches, through the areola, the junction of the pigmented area around the nipple and the normal skin. And again, it depends. It should be examined. The people they have a sharp transition, that could be a good option, because when the incision and the subsequent scar sitting at that color transition, it's gonna become almost invisible. Invisible.
Yeah.
And maybe I can draw. Yes. So let's start from here. Good. Here we go. So.
That's a matured breast.
Okay. Good.
Yeah.
All right. So. Good. So. Imagine the breast, nipple, and areola. I'm talking about. Let me use a different color. So. Yeah, that's good. Yeah. So when we put it here, right at the junction of the areola and the normal breast skin. So that would be really good for the people that they have a sharp color transition. A lot of people, they look at themselves, they, today you can look at yourself, how does it that transition happens. And some people, it's fading, so you cannot find any sharp transition.
Right.
So it doesn't have that advantage of the sealing the scar.
Okay.
The other approach, or the way to do that, is right at the breast fold. So here, of course not big like that, very small, but it's sitting at the breast fold. It has, again, good thing and bad thing about that. The people that the breast is matured and has some volume to cover that area is really good.
Mm-hmm.
But for some type of the breast that is completely, you can see the fold is straight. So when the people is topless, the scar is going to be more visible. Again, we have to choose which one is the best. It's not a cookbook, it's not a cookie cutter. We have to be examined and see which one. But at least this is two approaches so far.
Right.
And the areola naturally heals faster as well, right?
Not really.
Really?
Yeah. We need to bring our punch gloves next time. No, I think the healing is the same, and I'm not gonna say it's different.
The way I was explained was that the women are meant to breastfeed, so the areola heals a lot faster. So
Where does it go? I don't
might
know.
be wrong. And the umbilical, that's not really used anymore, correct?
Yes, it still is one of the approaches, but for those incisions through the nipple or through the breast fold, you can use for saline or silicone, either one.
Mm-hmm.
But through the belly button, it's just good for the people that want to go for saline implant.
For saline?
Yes, because through a small incision through the belly button, you have to blindly dissect the whole tract or path to reach to the breast fold and opening and cut the muscles and make another pocket there. Personally, it's not my favorite approach. It's not my favorite approach because I rather to have a direct access to the incision to the pocket. I don't like to go do it blindly. So
I think a lot of patients are like taken back a little because I don't know if I can speak for anyone now.
yeah.
But when it's your areolas or this area, it's pretty sensitive for most women. So when you think, okay, I'm gonna make a small cut here, and I'm like, it kind of gets me like, oh my gosh, like how is that gonna feel? That's so like, am I gonna lose sensitivity?
Or a lot of people are concerned about the sensitivity as well.
Yes, and if somebody again, if you ask me, is there any chance to lose sensation? Yes, it's very rare. It's so nil.
I don't know anyone who lost sensation by any of your patients.
It's more and they love it.
It's more sensitive, yes. When it's right after the surgery, it's more sensitive. It means okay, the nerves are completely intact. It's just a matter of time. They have to give about 2 months or so. It's going back to normal. But if somebody, let's just finish the subject that Crystal brought it up about the all approach and ways to do the implant. There is one more approach to do this through the armpit. Through the armpit again, actually that was the way I tried to do that. Yes, and that's the way I started. But very soon I put it away.
I may be wrong in telling patients, okay, there's a lot of bacteria due to the sweat glands
are there.
We clean the skin. I mean, that's not a problem, and there's no numbers. Healing might be a little bit problematic. The other thing is, imagine, okay, whenever we cut the skin, we have a scar in that place. But nowadays, most of the ladies, they shave their armpits. It's gonna be undercut, and the chance of the ladies, they go with the sleeveless, especially California, and they want to raise their arms, and I don't want they get concerned about the raising their arms. Oh, anybody's seeing the scar or not?
The scar is there, yeah.
Yes, so combination of all these factors, it made me to move from the armpit, and it's a long time I don't do it from the armpit. Even I have seen some of my colleagues that have done through the armpit that there was a great results. It matters. Let me make a point for you. you should let your surgeon to make decision the right approach for you. If somebody is going through the armpit and make a great result and you want that, that's fine. Go with that. It's okay. If somebody just going through the nipple and making great results, go through that. If somebody go through the belly button and making great results, go with that. So all of these are accepted approaches. We can do that.
Okay.
Okay.
Can we quickly just say hello
Yes.
to a few
Hello.
people?
Hello, everyone.
We have Citra Dewey. She's giving you a thumbs up.
Thank you.
We have Marisol Vitalia. She's waving hello.
Hi.
We have Vita with the heart eye emojis.
Hi, Vida.
We also have Skin and Beauty saying hello, and Candace, she's waving hello.
Hello. Hi,
So,
Candace.
hi, everyone. If you guys want to comment where you're seeing us from, or if you have any questions, you can go ahead and do so now.
Thank you for following us.
Yeah,
And I wish those information be helpful and
Yeah.
just spread it out.
Of course, yeah.
Okay.
Most of the questions they.
That's a part of our job. I mean, as a medical practice, we have to educate. We have to.
Of course.
Because the good thing actually about the internet, everybody is such a quick access to a lot of information, the source of information. But the point is, which information is valid?
Right.
Because, for example, if today I want to go and shop for something, easily I can get information, but not all of them are valid and legit information for me. I can get confused so easily. That's good thing and bad thing, like everything. And that, I think that's one of our job as physicians, to just educate our community and give them information. Very good.
I always tell patients, make sure you talk to your doctor. He's the professional. A lot of patients talk to their friends, and all of a sudden they change their mind about certain things, about the implant size, and it's very important for you to remember the reason why you chose a specific size with your doctor, because that's a very common thing.
Yes, yes.
In this case, for this doctor, someone had a question saying, what does the K in surgery mean? So I think Dr. K, plastic surgery.
Okay.
Yes.
K is my initial of last name. It's Khosravi.
Khosravi, yeah.
Yes. K
Good
is
question.
Yeah.
good question. K also what does starts with K?
Oh,
He
can we
needs
plastic
plastic
surgery? Everything.
Yes. Yes.
We have Laura Diana. She's saying, yes, he's the best.
Oh, thank you, Lourdes.
Oh, I've
Thank
seen
you.
something called the K lift.
Yes.
Oh, okay.
That's good. Yes.
The K.
The K lift, actually, I can say that's the my technique
Signature
of the breast
procedures?
lift. Yes, is my technique for the breast lift. When it comes, especially for the people, I started to do that for people. They come and say, "Doctor, I want my breast lifted, more pericare, more fullness in the upper pole, but I don't want any implant.
Right.
Is that possible or not?" So I notice for a lot of cases I can do that.
Mhm.
And I can say, all right, I combine different techniques of the breast lift, and also I added something that has not been described before, just to work like the inside bra to give longevity and give the fullness and give the support of the breast, and redistributing the breast tissue to give the fullness that we wanted in the upper pole. So is my signature breast lift is called K lift, and we have some pictures I think posted on Instagram,
Yes.
and just showing that how we can get the lift without any implant, but looks like the patient had the breast lift.
It's specifically for patients who already have breast tissue, and you can work with that too.
Yes, and at least we could get to some of them there. Yes, the patient should have the breast tissue to be able to use those tissues and redistribute those tissues to be able to achieve the result. It's not, for example, somebody who's flat completely. I cannot achieve that the result.
Right,
Yeah.
right. Because some people may need a lift, but the results that they're expecting would require an implant
Yes.
Right?
That's right.
to meet
Yes.
their expectations.
That's correct.
That
That's correct.
reminds me, which goes to the question that a patient had submitted before. She was saying that she hasn't had kids before,
Yes.
but her breasts are naturally
Sagging.
sagging.
Yes.
And she's pretty young. She's in her mid-20s, so she's wondering, what do you recommend for her?
Remember, the very first case we did a K-lift for her, she was 21 or
Yeah,
22.
she didn't have any
Early
kids.
20s, yeah.
Yes, early
Mm,
20s.
no
And
kids.
exactly, no kids, no nursing, nothing in the future. Just the nature of her body. The breasts were sagging down and had some tissue that we made it. That was very first case. So age doesn't mean anything.
The sagginess may be from weight loss.
Could be from weight loss. Could be hereditary. I mean, that's running in their family maybe, or in the
Yeah.
sisters, mothers. Oh, we get a sign. We just have 3 minutes. Yep. Okay, so we have to wrap it up. We didn't get a chance to talk about all the details of the implants. Maybe we can continue.
Yeah.
Continue
Yeah,
next
let's
week.
Continue next
Yes.
week.
You're done.
And,
You're not playing with
Oh
them
no,
anymore?
You're
Oh,
welcome
okay.
I'll play with
to
them
send
later.
your
Put it in the box.
DM your questions, and we'll have answers for you next week, or we can email back and forth.
Very good. All right.
Go out and vote, everyone.
Yes. Yeah. Don't miss it. Somebody should tell me.
Yes.
Thank you for following
Thank you.
us. Hope to see you
Bye.
next week. Bye bye.